importance. Q11. Why has it become imperative for policymakers in India to devise measures to effectively curb the use of tobacco and its products? In the light of failure of many policies to curb its use, what policy recommendation would you make to severely curb tobacco consumption in India? Discuss. 250 words. The Hindu. Why is it imperative to ban tobacco and its products in India? Economic. India is the second largest consumer and producer of tobacco-based products and are categorized as thin goods or demerit goods. www.insightsindia.com 56 www.insightsis.com. India's distinct pattern of tobacco consumption is in multiple forms such as cigarettes, bodies, chewing tobacco and quinine smokeless tobacco, in contrast to the global trend of cigarettes being the primary source of consumption. Treatment of cardiovascular diseases and cancer imposes maximum financial burden on the individual and family. Health, non-communicable diseases and diseases like ischemic heart diseases, cancers, diabetes, chronic respiratory diseases are the leading causes of death globally and associated with tobacco use. Smoking acts synergistically with other risk factors like high cholesterol and blood pressure to increase the risk of coronary heart diseases (CHD). Respiratory diseases effect on pregnancy and its outcome. Maternal tobacco use during pregnancy and exposure of child to second-hand smoke in childhood is known to be a risk factor too. Chemical tobacco products contains around 5,000 toxic substances. Psychological, low emotional stability and risk-taking behavior are more common in tobacco users. Environmental, for cultivation of tobacco crop forests are destroyed. Burning of tobacco produces number of toxicants in environment. Manufacturing, packaging and transportation also cause environmental pollution. Failure of many policies. Governments have resorted to a mix of policies which range from monitoring the pricing and taxation regime of these products, focus gradually shifting towards awareness campaigns highlighting the deadly effects of tobacco use, regulatory control laws pertaining to packaging and labeling, as well as shaming and prohibiting its use in public places. The nationwide implementation of the Goods and Services Tax (GST) has not improved the situation either. All tobacco-related products have been placed in the 28% tax slab. This led only a marginal increase in price, leading to no effect. But still a lot needs to be done. Recommendations needed. The revisions in the taxation policy concerning tobacco products should ideally have a mix of a removal of all excise and other tax exemptions irrespective of the size of the unit, restrictions on sales of loose sticks, raising taxes / duties on bodies and smokeless tobacco by a significantly higher level to narrow the price gap between the bodies and smokeless tobacco vis-a-vis cigarettes. Integrate cessation activities into formal health services. Health workers, who are often the first point of contact for patients, can also play an important role in tobacco cessation counseling. Training health professionals in tobacco cessation. Provide brief counseling and referral. Routine assessment of tobacco usage and brief counseling is known to have a positive effect on users. Technology, telephone helplines have played a major role in tobacco cessation in the West. This can be tried out as a more cost-effective intervention method. Innovative measures such as mobile apps and peer support platforms using social media could also be tried out as additional strategies. Awareness needed to be generated from the school level itself, with some lessons on prevention of tobacco use in the school curriculum. Also, strong surveillance mechanism in schools and colleges is necessary. Providing incentives to farmers to reduce tobacco production. COPTA Act needs effective implementation. www.insightsindia.com